what is macular degeneration? Now this causes a lot of fear amongst people because you kind of start thinking about blindness and stuff when you have a diagnosis like macular. The macula is the central portion of the retina, and when you're looking at me on the screen, all of the image is falling onto the macula, so it's the most sensitive portion of the vision and the most sensitive portion of the retina. As we get less young, that does start wearing down a little bit, and you can get deposits of waste materials there, something called drusen. You can get pigmentary changes whereby the retinal cells just start dying off, just like everything else. You know, these things, we have a finite shelf time, and things start wearing down as time goes by, and everybody gets some degree of dry macular degeneration as the years go by. Threading a fine needle is harder, contrast becomes harder, grey on grey becomes harder to see. It's inevitable and it hits all of us. That is the dry macular degeneration, and that doesn't cause any major issues in the majority of people, although some people it can lose them central vision eventually, but slowly progressive, so you don't really have to worry about it if it's in its early stages. There has been a big study looking at this and found that if you take multivitamins with zinc and antioxidants, it can slow down the rate of the wear and tear. It's a bit equivocal and some people poo-poo the whole thing. You may be just paying for expensive weed, but I'm actually a little bit of a fan of it, and if you can do something, as long as it does no harm, and it does a bit of harm to your wallet, then I'm quite keen on them. And there are lots of multivitamins out there. You can speak to your pharmacist or optician about them and they'll be able to advise you. If you have dry macula, not a big deal. Doesn't need hospital follow-up, just keep a check on things. But you need to check your vision one eye at a time on a regular basis, because 10% of people with dry macula can develop wet macula. And wet macula involves blood vessels growing underneath the retina, and that can cause problems. And if it's untreated, it can cause major issues and visual loss. The reason why I ask one eye at a time is because sometimes you don't notice the vision's going down in one eye. So if you check the vision one eye at a time, you'll notice. Distortion, a bit of a wobble is okay, but if it's massively wobbly, you need to seek attention. Big blob in your vision goes down suddenly, all stuff you need to seek attention for. Now when I say seek attention, part of that depends on how bad it is. If the vision is a little bit dodgy but you're not sure, then opticians are best port of call and quite easy to see because they've got easy access. If your vision goes down dramatically and you're known to have dry macula, then the worry is you have wet macula, and then sometimes you need to attend the acute eye service at the hospital. But often the optician is the best port of call for you. Wet macula can be treated. It's not a definite that you're going to lose vision or go blind because of it. It's treatable. It sounds ghastly, but we give you injections into the eye of something called an anti-VEGF. VEGF is vascular endothelial growth factor, and that is the stuff that actually drives these new blood vessels to grow. And we inject you with an anti-VEGF in order to settle it down. This is a big advancement because historically, 15 years ago, the prognosis used to be pretty poor. Actually, more than 15 years ago, the prognosis used to be very poor. But now with these new treatments, we can stabilise vision. We don't tend to improve vision, but we can stabilise vision and stop it getting any worse, which is fantastic. As I said, it sounds ghastly, but it's not as bad as it sounds. So please, if you've got dry macula, 1, consider multivitamins. I'm a believer in them, other people aren't. 2, check your vision one eye at a time, and it's really important that if your vision suddenly goes down, you get lots of distortion, seek attention straight away. I often ask people to look at a picture on their wall and keep on checking themselves with that, and if suddenly a nose is really distorted or something like that, then you know that things have changed and then you can report it. So if you do have dry macula, it's not a big deal. Wet macula is not a big deal as long as we pick it up early, but it is important to watch out for these things.